Hi, I'm Dr. Carey Clark. This session's been recorded, but I am here live to answer your questions in the chat. Hi, everybody. My name is Dr. Carey Clark. I am a registered nurse. I'm an advanced holistic nurse board certified and a fellow in the American Academy of Nursing. I am also a professor and the past director of nursing at Pacific College of Health and Science, where we have a medical cannabis certificate program. And I'm here today to talk to you about cannabis and palliation for pain. So let's go and get started. You can see my bio there as well, or my picture there, and my contact information. So feel free to reach out to me. That email is a great way to reach me. And of course, I can also answer texts if you have questions. So what we're going to talk about today is hopefully you're going to get a great understanding or a beginning understanding of how cannabis can support palliative care. And you will also consider how cannabis can be used to help patients who have pain from either serious or terminal illnesses. Okay, so I want to start with this study. When this study came out, I was so happy. So this study was done in a large comprehensive cancer center. It says in a state with legalized medicinal and recreational use. Well, I will tell you that that was Washington State. These were oncology patients, and they looked at close to 1,000 patients, over 900 patients, and they were asking them about cannabis and the information and care they received around it and what their use of cannabis was like. So 74% indicate they want information about cannabis from healthcare providers, but only 15% were getting any info at all from their healthcare providers. So you can kind of see where that's a big problem when people have a serious oncological treatment regime and aren't getting access to healthcare providers that can support them in using cannabis safely and effectively for their palliative needs. So 66% of the patients had used cannabis previously, with 24% in the last year and 21% in the last month. And what were they using it for? Well, both for physical and neuropsych symptoms. And as you can imagine, when patients have oncological treatments, all of their body systems are effective. And we know how cannabis works in the body to bring us back into homeostasis and support our feeling good and our wellness. So it's a great medicine to use for palliation and pain and all kinds of other symptoms that go along with oncological care. So of those 222 active users, how were they using it? A good percentage were using it at least weekly, and 74%, while 56% used it daily, and some, 31%, actually were using it multiple times today. And they 51%, so the majority, felt like cannabis provided major benefits for them. And 39% said, it's providing us moderate benefits. And how were they using it? Both inhaled, 70%, and medibles. So when I see that number, I think, oh, these oncology patients are using cannabis in a variety of ways, and they're probably using the inhaled medicine for when they have a very more intense or acute, or other type of need. And then they're using medable for when they need a longer acting medicine. So a medable is a medicated edible that will take a while to have onset, anywhere from 45 minutes to 2 or 3 hours, and then will last for a number of hours as well, depending on how it's formulated. So cannabis can address pain and many more symptoms. So I know my title here is about pain, but I'm also a holistic nurse. So I do also like to see sort of that bigger picture of what's going on with patients and with studies. So I love the study that was done here in Israel in 2018. It was with over 3,000 cancer patients, and they started using cannabis for pain management. Well, lo and behold, they also showed improvement with so many other issues that they're having related to their cancer care. So 70% saw improvement with their sleeping. And we know that's a huge issue. If patients are not getting enough sleep, they're not going to be happy and they're not going to be healing well. And speaking of being happy and healing well, Patients that get oncological treatments are generally not happy with their nausea and vomiting, or what we call emetogenic care. So in this case, patients showed 54% of them showed improvements with nausea and vomiting. They also had less fatigue, and their anxiety and depression, 74% said that cannabis helped with that. And this is just amazing for these patients that had pain related to their cancer care. They had an enhanced quality of life from their baseline score of 18.7% up to 69.5% to a good level of quality of life after 6 months of use. 36% were able to stop their opioid use, and less than 20% stopped use of cannabis, and mostly that was related to side effects. But let me tell you a little bit about cannabis care in Israel. So, in Israel, patients can have access to medical cannabis, and they also get access to a cannabis care nurse who has been specifically trained, who can help walk them through how to use cannabis, the dosing, and how to use it properly, and can be there hands on with the patients. So I think that's one of the reasons why they had such great success with implementing cannabis here, that they were actually most likely using nurses in this study to support patients with their proper and safe and effective use of cannabis. All right. So, how does cannabis? So, we saw the results of the studies. One is patients are using it, and two is that they're using it and having really good benefits and better palliation for pain and other symptoms that come along with serious illnesses. So, how is this amazing medicine working? So, in our bodies, we have these things called cannabinoid receptors, and they're throughout all of our whole bodies. And we also have these amazing substances that our bodies make called endocannabinoids. And those endocannabinoids that our bodies make help to keep us in homeostasis. They interact with the cannabinoid receptors, and they're also present in our pain circuits throughout the entire nervous system. So there are these receptors called CB1 receptors, which help to modulate pain sensitivity, or something called nociception. And we know that THC has a bit of an affinity, definitely, for CB1 receptors. So, what is this idea of nociception? So, when the person uses a cannabis product that has THC and it interacts with these CB1 receptors, when they have pain, uh, they maybe just don't care about it so much. So that's what nociception is, kind of like your perception of pain. The pain may still be there, and you may even still be perceiving the pain, but it's like you just don't care so much about it. So that's what nociception is. And then we have these CB2 receptors. And we know that CBD in particular has some good affinity with CB2 receptors. And when they are activated, the CBD helps to decrease inflammation. There are many more cannabinoids that are related in the pain process or systems in our bodies. And there's also many more receptors. But I just wanted to touch on those two because they're kind of the two that you hear the most about, and that we know how they interact here with the plant medicine to address pain. So that nociception and then decreasing inflammation. Okay. So here's another study for you. I love this study because they did it in New England and I live in Maine. So they actually used some of the dispensaries in my area back in 2017 when they did this study. So again, they looked at close to 1,000 chronic pain patients. And they found that when patients were using cannabis, they had good relief and were able to decrease other medications. However, the cost and the stigma were a concern for patients. So this was published about 4 years ago. But what I can tell you is that the cost and the stigma are still issues for patients. I met a nurse, and this was at a conference, and it had nothing to do with cannabis other than I was there as at that time, the current president of American Cannabis Nurses Association. And it was a nursing organizational association conference. So there were nurses from every other specialty out there in nursing. And so, of course, everybody wanted to talk to me because cannabis care crosses all realms of healthcare. But this nurse wanted to talk to me about her personal situation, which was her mom was at end of life and was on hospice, was having a lot of symptoms, and they were using cannabis effectively for her. And one of the benefits of cannabis over sort of over relying on opiates, and cannabis can be used safely with opiates, but many people find they can use far less opiates. And at end of life, it can really prevent something that we call sort of withdrawal of the patient as they um, end up using more and more opiates, or sometimes we even refer to patients as sort of being snowed under by opiates, like it's hard to get them to respond and so forth. So if they're using cannabis more regularly, we can prevent some of that over reliance on opiates. Anyway, so this nurse says to me, we're using it effectively, but the cost, $900 a month for this patient on hospice care to have their symptoms managed effectively with cannabis. And this was a few years ago, but the cost is still very expensive. And most insurances and most, hospice, which is supposed to cover all of your end of life needs, does not, in general, cover cannabis care. So cost is still an issue. And stigma is still lingering. I like to talk about we've been in a cannabis prohibition era for over 100 years, but gosh darn it, we're making our way out of that era. But as we make our way out of that era and move into what I call a regulation era of cannabis, where people can now access it, it still is highly regulated. There still are laws and rules and regulations around how much cannabis you can have, and it's all based very much so on your zip code and where you live, whether it's adult legal use or medicinal use. There still is that stigma left from the prohibition era. So sometimes patients are afraid to bring it up. Sometimes they're afraid to access it. Sometimes they're afraid to talk about it to their healthcare providers, right? So we really need to, regardless of your role as a healthcare provider or if you're a patient, kind of overcome those barriers that have created the stigmas. All right. So I started to talk a little bit about opiates because I was getting ahead of myself there. So this study was done at UCSF, and they found that cannabis, when they looked at chronic pain patients, that it was actually better than opiates. So opiates they're really good for end of life care. They're really good for acute pain in short sort of periods as prescribed by a provider. But cannabis overall has fewer risks and less side effects. Most studies, though, have had a really small N or number of participants when we look at pain due to the prohibition effect. But the National Academies of Science, Engineering, and Medicine has stated that cannabis is effective for pain. And cannabis can actually sort of, we talked about it's safe to use with opiates or morphine, and it can also sort of work synchronistically with that morphine, or synergistically is probably the better word there, um, to so that both medicines are actually working better and patients are getting better relief. So oftentimes what we see is if someone's been using opiates for a long time, they can sort of gradually taper down their use of opiates as they increase their use of cannabinoids. All right, so cannabis and spiritual pain. I had an experience where I got to do some training as a hospital chaplain. I did the training. I didn't actually ever get to work as a hospital chaplain as a volunteer. Maybe someday I will. But during that training, we looked at spiritual pain. And what the chaplain said there, and there's some good research out there about it, is that our medicines that we have, like our opiates and our anti anxiety medicines, things that we think address pain, whether it's intense acute pain, chronic pain, or end of life sort of terminal pain, none of those will come close to touching spiritual pain. So sometimes when we have patients that have what we call intractable pain, where they have pain that's really not being touched by opiates and they're escalating their doses and it's not getting better, I would like to think that perhaps we need to consider that they're having spiritual pain. And cannabis is a plant entheogen. So what does that mean? It means it's one of the few plants out there that we know about that can help us with our spiritual needs, can help us address our spiritual issues, and even address spiritual pain. So how it works as a plant entheogen is that it helps us to relax, helps to bring us into what I call sort of that present moment of really being present with the self, and to create a sense of inner stillness. So there are things that we can do to use cannabis as a tool where we can set intentions and practices, do things like light a candle and say a prayer before using cannabis. Focus on being in the present moment. Maybe a patient feels well enough after using cannabis that they can do some meditation or a guided meditation, that they can move their body and do some yoga. So I want us to be very mindful that cannabis, yes, great for that physical pain. Remember, we talked about nociception and working as an anti-inflammatory. But I love this quote here: to relax down into direct and intuitive heart perception of the wisdom of the body. Cannabis can help us enter deeply into the present and those present moments, and it can help us awaken from the illusion of separateness. And part of our spiritual healing is to understand self, understand others, and understand our place in the universe. And when we have pain, whether it's acute, chronic, or end of life, or even intractable pain, it provides us an opportunity for healing. And cannabis is really a plant entheogen and plant ally that helps us with that. So we can also focus on, when we're looking at pain management, upregulating the endocannabinoid system. So a lot of our holistic and integrative modalities help us upregulate endocannabinoid system tone. Things like exercise, moderate activity that we enjoy. Usually I think of aerobic activity several times a week can, what we used to think of as the runner's high, and everyone says, oh, that's endorphins. Well, now we know, no, that's anandamide. That's your body's own cannabinoids helping you to feel great. Changing our diet so that we have a balance between the omega-3 and omega-6 fatty acids, and concentrating on taking in more flavonoids, which are the colorful parts of fruits and vegetables. There's also flavonoids in the cannabis plant itself. Decreasing sugar and other toxins that create sort of stressful situations for our bodies, and that put a little tax on the endocannabinoid system. Things like massage, acupuncture, osteopathy, all of those have, if you felt good after that, you've had a massage, you feel amazing. There's been a few times I've had acupuncture where after the session, I was like, wow, I feel so good. I'm not even sure I should be driving right now. So that's all our own endocannabinoid system helping us to feel good. And so part of our work, for those of you that are providers, is to help support patients in changing their lifestyle so that they can have an upregulated endocannabinoid system, better homeostasis, and use less cannabis in more effective ways. So providers, you want to look to see that you have your policies and procedures in place for your setting. Um, you want to look at, how is this patient going to access the medical cannabis? What is their prior use? And if they're a hospice patient and looking for palliative care as well, what is their life expectancy? And really considering that. So does that mean we need, if they have a longer life, how are we going to use cannabinoid sort of expectancy over those months? And if they have a shorter life, that may change how we look at how we're using the cannabinoids. Um, and do they have a risk for addiction? Of course, if they have a longer life projected, we may want to use more CBD if they've had a previous addiction issue. But regardless of that, many people have been able to, that have had previous addiction issues, have been able to use whole plant medicine safely and effectively. I really think we need to think about the sort of first line treatment debate when it comes to cannabis. Oftentimes we hear it's not time yet for um, medical use of cannabis. We can do that later on. It's not time yet for even palliative care. And I will argue there that yes, it is time. Anytime somebody has a chronic illness, anytime that somebody is facing a very serious or terminal diagnosis, it is time for cannabis care, most likely, if the provider can really see a benefit and the patient is motivated and wanting to use it. And of course, they're in a state and zip code where that's allowed. So we want to support them in their medical recommendation process. This will vary from state to state, so you need to have that knowledge. We should support them in once they're out there accessing, coaching and guiding them through the cannabis diary. So, what is the chemovar that they're choosing or strain you may hear more commonly used? So, what is the plant medicine that they're using? What is the dose? And what are the effects? And are they having any side effects or adverse effects? We need to advocate for our patients to have access to safe and effective cannabinoid medicines. And we need to really work with them. We can educate, but we also need to coach. So, what does a coach do? They work with you, they guide you, they talk to you about your goals, they set you up for success, and they're walking alongside you versus, say, being paternalistic and telling you what to do. Thank you so much for attending this talk. Wishing you all the best as you learn more about medical cannabis and pain.